Hi everyone, myself Sharvari Rere, and today we will be learning about antifungal drugs. In that, we will be studying about polyene antibiotics, amphotericin B, and echinocandins. So let's get started. Polyene antibiotics. As the name suggests, poly refers to multiple and ene means double bond. Thus, the name polyene is derived from their highly double bonded structure. Amphotericin B, nystatin, and hemicin are the polyene antibiotics. Amphotericin B is the prototype drug. Now, polyenes are highly polar, hence, they cannot be given orally. Instead, we administer them either intravenously or give them topically. Amphotericin B is administered intravenously. On the other hand, nystatin and hemicin are given topically. Speaking about nystatin, nystatin is poorly absorbed from skin and mucous membrane. It is highly toxic for systemic use. It is used only topically in candida infections. Then hemicin. Hemicin is developed in India and it is used against vaginal candidiasis. Polyene create pores in the cell membrane. Let's talk about amphotericin B. It is obtained from Streptomyces nodosus. It is a broad spectrum fungicidal drug and it is the most effective drug. Let's see its mechanism of action. Fungal cell membrane consists of ergosterol. Amphotericin B binds to ergosterol and forms pores in the fungal cell membrane. Thus, the cell permeability is increased and this leads to death of the fungi. Let's see its pharmacokinetics. It is highly polar, hence not absorbed orally. It is administered intravenously as a suspension made with the help of deoxycholate. It gets widely distributed in the body. Its CSF penetration is poor. About 60% is metabolized in the liver. Excretion occurs slowly both in bile and urine. Now let's see its preparations. The conventional formulations. Amphotericin B is poorly water soluble. Hence, intravenous preparation is made with the help of deoxycholate. Colloidal dispersion, amphotericin B colloidal dispersion, amphotericin B lipid complex, liposomal amphotericin B are the new formulations of amphotericin B. In that, liposomal amphotericin B is the safest one and it has reduced toxicity compared to conventional amphotericin B. It is longest acting one. Let's see its uses. It is most effective drug for various types of systemic mycosis and is the gold standard of antifungal therapy. But because of its higher toxicity, azoles are now preferred. Empirical use of intravenous amphotericin B is often made to treat febrile neutropenia. Leishmaniasis. Amphotericin B is the most effective drug for resistant cases of Kala Azar and mucocutaneous leishmaniasis. Adverse effect. Toxicity of amphotericin B is high. Acute reactions are seen. Acute reaction occurs with each infusion and consists of chills, fever, pain all over, nausea, dysopnea lasting for 2 to 5 hours, probably due to release of cytokines. Also, thrombophlebitis of injected vein can occur. Then anemia. Due to bone marrow depression, anemia is seen. CNS toxicity occurs only on intrathecal injection. Headache, vomiting, nerve palsies, etc. can be seen. Long-term toxicity. Nephrotoxicity is the most common and most important. Manifestations are azotemia, reduced GFR, acidosis, and hypokalemia. Let's study about echinocandins. Echinocandins are the new class of potent semisynthetic antifungal antibiotics. They have low toxicity compared to amphotericin B. Caspofungin, micafungin, and anidulafungin are the echinocandins. Caspofungin. It is first and prototype member of echinocandins. It is active against Candida and Aspergillus. Strains of Candida that have become resistant to azoles are susceptible to caspofungin. Let's see its mechanism of action. toughness of the fungal cell wall is due to the cross-linking between chitin and beta-1,3-glucan. Now, what caspofungin does is, it inhibits the synthesis of beta-1,3-glucan. This leads to weakening of cell wall. Thus, the osmotic susceptibility of the fungal cell is increased. Pharmacokinetics. It is not absorbed orally, therefore intravenous infusion is given. It is distributed into the tissues, but it does not enter the CSF. Its metabolism is extensive and metabolites are excreted in urine as well as feces. Let's see the uses of caspofungin. It is approved for use in deep and invasive candidiasis, esophageal candidiasis, and salvage therapy of non-responsive invasive aspergillus. It is used in neutropenic immunocompromised patients whose fever is not responding to antibacterial antibiotics. Let's see few of its adverse effects. Organ toxicity has not been noted with the use of caspofungins. Rash, vomiting, dysopnea, hypokalemia, and joint pain may occur with the use of caspofungin. Acute febrile reaction attends the IV infusion, as does phlebitis of injected vein.